Hi everyone. Excuse me. Hello. On that note, I'm coming down with a little bit of a cold, so I'm coughing I'm coughing here and there. So excuse me if you kind of hear me coughing. But I hope everyone is having a great year so far. And it's been a weird winter, but we're kind of hopefully enjoying the kind of the warm winter we're having. And welcome to my channel, Ripples Hub, where anything and everything mental health get talked about, and the focus being on my minority women and issues that can come up. Today I'm gonna talk on a topic that really doesn't get addressed a lot, especially with minorities, especially even in our church communities, which are where I'm really deeply grounded in. And the topic is on grieving. I had posted something a couple weeks ago on grieving and talked about sometimes that grieving, sometimes it's not just on the loss of a person that we really deeply care about, but sometimes it can be different losses, loss of a job, going through the transitions of life, taking on a new career, kids moving out of the house, grieving a sickness that somebody might be recently diagnosed with and trying to get the processing going. Especially if it's a pretty serious diagnosis, it can leave a person feeling grieved. And it's hard to really label it right away if you really can recognize what the signs are. And if you don't really label it right away and talk about it and get the help necessary and get the supports that you need, quickly it can quickly go into different conditions such as chronic depression, chronic anxiety, insomnia, and all of that. So today I'm talking about grieving also because I feel like there have been so many losses recently from the start of this year, and it just kind of rings or close to home, or makes me kind of feel like maybe starting the conversation will help, because sometimes grieving the first week or two, what I've noticed, that a lot of people are around people who have lost people the first day to week also, and after that many people are left by themselves and to kind of go through the grinds of it, and it can come with so many mixed emotions, including one of the biggest one is guilt about continuing to feel sad or crying. And it can come in waves. One moment you're okay, and the next moment something reminds you of that thing that you lost, especially if it's a close person. From on the flip side, it's a person close to you that you lost. It can bring all that painful memories all over again. So I'm talking about grief today, and to anybody there who have experienced loss in the past, long time ago, recent, and all of that, or somebody, because having losses is something that we just have to be aware of. And maybe I'm just so more aware of it because working for so many years before, when I was inpatient as a nurse, and really getting close to so many families who are experiencing grief and going into hospice care, to the point of even doing postmortem care, all of that, seeing people grieve and having experienced loss of patients like that, and being so hands-on with them at that point, being inpatient, being hands-on, it's really made me realize from earlier on that life is very fragile, and oof, with really poof, you're gone. You're gone. And not to divert or anything, but going back to grieving and the signs. So grieving can be really healthy way to deal with the loss of a very close person or precious thing or person in your life. But the thing that becomes very hard and difficult for a lot of people is when grief gets to become complicated grief or complicated grieving. So grieving is a natural reaction to losses. So it comes with intense feeling of sorrow, of course, crying that comes with that, and sometimes it can come with some physical reactions as well, and which is all part of the processing of the loss and the healing that comes with it. And our brain, which is the biggest machine that we sometimes don't give enough attention to, is the brain making sense of the actual loss. So the difference between just regular grief and complicated grief is that in complicated grief, the adaptive reaction to the grieving process, and once again I emphasize on the process because sometimes it takes weeks, months, years to go through that process. It gets easier, but it's definitely a process. The adaptive reaction is disrupted. It's almost like a roadblock in the process, and it affects people's memories. It takes away the positive thoughts that comes with the loss of that person, the positive thoughts towards that person. The focus more is on negative thoughts or feelings towards the loss of the person. Believe almost like it's one's fault that the person was lost, and we can almost think of it like it's like when you get a wound, you get a fresh wound, a scrape or whatever it is, you put alcohol on it, or alcohol rub, or even the hand sanitizer on a fresh wound. It just stinks and burns right away, but then a little it starts to feel better, right? But in compounded grieving, it stinks like that, but that stink it's continuous. It doesn't get better. It's almost like a wound that instead of getting better got infected, and in the infection comes all the stuff that come with it. If you ever had a wound that got infected or seen a wound that got infected, you have an idea of what I'm talking about. And processing becomes hard because of all this stuff. Dealing with the different things that comes with that can be very challenging in terms of the loss. And so continuing from that, there are people with complicated grieving will start thinking, instead of the positive, start thinking of the negative, and they will say things such as, I'm good. You can ask them how they're doing. They will always respond by saying, I'm good, I'm fine, I'm hanging in there. People who grieve or lose it because they lost someone are babies, or they are weak, or they can flip it and say, oh my God, look at me, this is all my fault, this always happens to me, I'm always losing people because of whatever reason, or who I am, or my personality, or something that I did or didn't do. If I had just called that person, if I had just visited that person, if I could have just been there for that person, maybe the loss wouldn't have occurred, especially if the loss was very tragic or traumatic, or was very, very unexpected and sudden. They totally take ownership of the reason for the loss, and they're unable to move forward or move on beyond that. They feel sad one moment, and then they feel anger, they feel hopeless, they feel stuck, a lot for weeks and months at a time. They feel stuck on that. They almost feel like they are going around in like one cycle, just going around that same cycle, without really dealing with the actual loss and be able to process it. So some of the causes of a lot of people that go through compounded grieving and they are not able to go beyond those things I mentioned, could be one, childhood trauma. And childhood trauma is so huge, and so many people are walking around with baggages from childhood trauma that was never processed. So unhealthy, unresolved childhood trauma, losses as a child. If you had a lot of people, you lose people when you were a child or younger adults or whatever, it can really seriously affect, and it wasn't resolved, affect how you're processing current grief. And those feelings from childhood start to resurface back up, adding, to what's already is in the present, hence the term compounded. And people like going through it usually feel like it's their fault. Like I mentioned before, they invalidate, they don't validate the loss, or there are people around them. They might feel like the people around them don't validate the loss that they are dealing with enough. The culture also around that person is really important, because different cultures deal with losses differently. So the culture of, I'm sure, especially male, our males, our sons, our fathers, our uncles, how they process losses can be so different. They might cry, for one few minutes or for a day, and then the rest is just totally internalized, and people around them can mistaken that they've moved on and they're fine, and they might just not acknowledging that, or be able to label that people around them are not really validating the feeling of emptiness and loneliness and sadness, intense sadness that they are feeling, and they might not necessarily be able to verbalize. So the culture and the mindset and the environment in which that person finds themselves, it can also play a fact. Intense feeling of guilt, of feeling sad and all that. Sometimes there's delayed grief. Some people, it hits them, they're still in the state of shock, so they're not really grieving right away, so people can easily just move on from there. And then where later, a couple weeks or months later after the loss, that's when they actually start to go deep into the grieving. And if people don't check, just takes a second to just check on someone and shoot a text, call, whatever, email, WhatsApp, and say, hey, how are you doing, thinking of you. So just being really aware of the fact that people grieve really deeply, not just the first few weeks, but it matters a lot to check on people who have losses even down the line, weeks and months into it. And some of these people also, cause can be during the first days or weeks of the loss. They are busy planning funerals, arrangements, making calls, all this. They are like in a state of a trance. Sometimes some people are overeating, they are not eating. They are scared, they can't express the fear. There's all these family members coming along. All this stuff just makes it where they just shove all their feelings to the side and deal with everything. Financial aspect of it is huge as well, especially in my culture. Who knows what else pops up into stuff like that. Extended family comes into play, who is not getting along. Now you have to deal with them. So that can also cause and lead to complicated grieving. But in our culture, once again, especially a culture being from Africa, other people as well, minority cultures, we go through this all the time. So moving on from that is that compounded grieving can be so hard and difficult to deal with. And sometimes even things such as like invisible losses that people have, especially women, who have invisible losses such as a miscarriage, depending on what the stage of pregnancy that was, and that was never acknowledged or dealt with, or have closure with that loss, can also lead to compounded grieving when somebody else passes, or that person loses somebody else, even when they had that loss and was never dealt with. Sudden losses, recurrent losses, to the person, even people around us. I'm doing this because there have been so many losses, just this year, beginning of this year alone. Yes, we're praying, and we don't want it to happen, but it's happening. And death and dying is such an intricate part of our life and society and our communities that we don't deal with it well at all. So recurrent losses, definitely, around us, you hear it, you get scared a little bit, you leave it, and then it happens, and you just wait for the day that it will be at your door, so to speak. And this complicated grieving, or compounded grieving, so to speak, is actually in what we call the DSM-5. For those of us in psychiatry, the DSM-5, labels it there. So it's a diagnosis that needs to be looked at and treated, because it can become chronic. And it actually says it in the DSM-5 that it needs further studies, because it's so complex and compounded, and it goes in waves, like I said before, and it can be very persistent and chronic in nature. So things that pertain to the brain, like I said, if you don't deal with it, it can become chronic, and it can overflow in so many aspects of our lives, to even hallucination, feeling like you're seeing the person who is passed on, hearing things, smelling things, and it can be very real, very real. So to be diagnosed with compounded grieving, one of the signs out of the 6 that I'm going to be listed will be one of it. So if you identify with one out of the 6, so for this first part, then you might possibly be experiencing that kind of grieving. Intense yearning or preoccupation with the lost person, feeling empty, lonely, being isolating, feeling numb, feeling shock, longing to join the person who has passed on, or who've lost, some thought of suicide, like I said, even hearing voices, seeing, smelling, can't sleep, feeling anger, starting to feel bitter towards the people around you because of the loss, experiencing the pain, depending on what happened, experiencing that pain that caused the loss, constantly ruminating about the way the person passed on, if it was very tragic, like I said, and yearning, daily to join the person. So any of this, just one, will be one of the signs that you could potentially be experiencing that. Isolating, and one of the other ones, so either one, or either one or two, and you've been going either one or even sometimes two, I should say. And if you're experiencing this for more than 6 months, then you're likely dealing with compounded grief, and you have to seek help. So seeking help is very, very important to be able to move past the barriers and move past compounded grieving and go into actual grieving, and help the brain to process it. in our practice in psychiatry, we use modality called the CBT modality to process, to help patients go through it and process any trauma that could have happened around the loss, and be able to process and go beyond that roadblock, and it helps it get better. Otherwise, like I said before, it can overflow into depression, anxiety, insomnia, name it, PTSD, and all that. So, reach out, call. This is the time to rally all the support people around you, and for people to be aware. And that's why I'm doing this video or this podcast, so people can be aware to reach out to that person. So, any questions, bring it to me. Any questions, any suggestions. I would love to carry forward this conversation and talk more about it. So we be looking forward to my next podcast as well. I hope everyone gonna have a great weekend and a great rest of February. We're always ready for March, and have a blessed one.